Well, it's been a busy day of news about Omicron. Let's try and unpick some of it. As promised, we've got a panel of experts tonight. I'm joined by the Professor of Paediatrics at the University of Bristol and member of the Joint Committee on Vaccination and Immunisation, Adam Finn, Senior Clinical Lecturer at Exeter University and Public Health Expert, Dr Bharat Pankania, and the GP, Dr Rosemary Leonard. Great to see you all this evening. Thank you very much for giving us your time and trying to answer some of the questions that we've had through to us at Sky News today. Let's crack on with those questions, shall we? Perhaps starting with you, Professor Finn. This question from Julia Bolston. Now, Julia says, as a mother of a 20-month-old, how worried should I be about Omicron? What do scientists and doctors say about the effects of the new variant on young children?
Well, of course, we're still only just learning about Omicron at the moment, but I think I can be very reassuring to Julia on this question, because one of the things that we've seen consistently through this pandemic is that children are much more mildly affected than adults and very much more mildly affected than elderly adults by this virus. And the younger the children are, the less likely they are to get seriously ill. So it would be a very big surprise to see that trend change with this new variant. And we've certainly not heard any reports of serious illness in children from South Africa so far, nor seen any in Europe.
Yeah, it's good news, isn't it? Let's hope that continues. And just staying with you, Professor Finn, how long do you think before vaccines are brought in the UK for young children? Not 20-month-old children, obviously, but 5-year-olds and above.
So we're expecting a verdict from the MHRA as to whether or not the younger children, whether vaccine can be authorised for younger children. And as soon as that comes through, it'll be being discussed by the JCVI. So a decision on that should be expected certainly before Christmas.
Yeah. Dr Leonard, it's very hard, isn't it, for parents? Because, of course, all parents want answers. They want to know what the best thing is for their children. But when they come and see you and ask questions like this, you simply don't have the answers yet.
No, but we do have some answers. As the professor said, we know that in very young children and in school-age children, serious illness from COVID is extremely rare. So I think parents can be reassured about that. We have parents who are worried about side effects from the vaccine, and I look forward to hearing the recommendation of the JCVI as to whether the risk of the disease of COVID is greater than actually any risk of the vaccine. It's going to be a very finely judged decision, but I think parents can be reassured that actually this isn't, the vast majority of children, this is not a serious illness.
OK, let's move on to another question, and this is sort of looking ahead, really. And Dr Pankania, perhaps you can help us with this one. It's from Dean in Slough, and Dean asks, what advice would you give to the government to try and avoid more problematic variants that could arise in the future, so even beyond Omicron?
What we have to know is the natural history of viruses. And it isn't advice to the government, but it is advice to all governments. And whilst you can get a random mutation, you must read it as a mistake, which then becomes favorable to the virus and it becomes a new variant. That can happen at any place, anywhere, anytime in the world. Having said that, the probabilities of having variants emerge are under the following circumstances: where you have a lot of infections, where you have a prolonged infection, where you have a prolonged infection in somebody who is immune suppressed, and where you have those prolonged infections in an immune suppressed person, that mistake upon mistake upon mistake, meaning mutation, in a person who's generating several generations of the virus, can lead to the emergence of a variant. So what should we be doing? This is a global issue, and the global issue, and especially with the richer nations, is this: we are not well until all of us are well, and we have failed in this task of immunizing ourselves, as well as helping Africa and other parts of the world to also suppress their infections. So the answer to Dean in Slough is all the nations, especially the richer nations, with the WHO, need to work harder, a lot harder, and suppress infections globally. And if we suppress infections globally, we reduce the chances of such variants arising again.
Yeah, and just staying with you, what do you make of this news that we've just heard coming out of South Africa, that there is a substantial risk of immune evasion with Omicron? Reinfection rates seem to be twice as high as the original Wuhan strain.
So it is of much concern if it is vaccine bypassing. In other words, the antibodies made by our vaccines are not able to latch on to the virus and neutralize it. So it is of concern. However, what I want to say is it won't be a 100% vaccine escape. That is highly, highly unlikely. So marginally, the efficacy may drop by, say, 10, 15, 20%, but you are still protected by the existing vaccines. And the booster will be giving you an additional enhanced immunity. Furthermore, your T cells will also be being boosted. So at the moment, the best thing you can do is be fully immunized, including your booster, and take other infection control measures. And if we have to reformulate the vaccines, we can reformulate them, but we only reformulate them if it is absolutely necessary.
OK. Dr. Leonard, this is a tricky one for experts such as yourselves to answer, but I'm going to ask it anyway because it's something that so many people are thinking about. When is South Africa likely to be removed from the red list for UK citizens who've booked to see family this Christmas? Should we cancel our flights? That coming from Madeline. Once again, just as we thought travel was resuming, returning to normal, it's all in disarray again.
Yeah, I mean, and unfortunately, this is impossible for me to answer. It will only be possible to know when travel will be freed up again, actually, not only South Africa, but across Europe, when we know just the effects of this variant, just how is it more infectious? Does it cause more serious disease? And unfortunately, at the moment, it's a question of we've got to be patient. We've got to wait for the scientists to do their work. And we can't try and jump the gun and say, oh, yes, it will suddenly be freed up. We just don't know. We've got to be patient. And I know people don't like living with the unknown, but that's what we've got to do right now.
Yeah, I mean, it is the message, isn't it, that we're hearing over and over again. It's a sort of a watch and wait scenario. Adam Finn, the UN Secretary-General today, it was quite interesting, I thought, said that restrictions isolating individual countries are ineffective and even went as far as saying it's travel apartheid. Many would say surely a much better system of testing, being absolutely rigorous with that, would be better than the situation we've got at the moment where countries are sort of randomly being picked and told, no, we don't want anyone coming.
Well, there is a certain randomness to this in a way. I certainly think that colleagues in South Africa have helped us a great deal by giving us information very promptly about this variant, which almost certainly didn't originate in South Africa, but it was their vigilance that brought it to the world's attention. And I suspect that it's quite widely distributed around the world, and the more testing is done, the more we'll find of it. So, yes, on the other hand, I can see why travel restrictions are being brought in simply because of the experience at the beginning of the pandemic when we saw such rapid propagation of the virus around the world. And people wished that they'd been quicker to restrict that from happening at the beginning. But you're right that an effective way of testing and tracing and trying to reduce transmission is the ideal approach to this. And that's clearly what we're trying to do in this country at the moment.
Yeah, because, of course, we all know the huge economic impact that shutting off international travel can have. Thank you all for the moment. Do stay with us. We're going to take a break in a moment, but plenty more questions to come. We can take a look now at some of the latest COVID data for you. Let's bring that in and show you the latest numbers. It shows that 53,945 new cases of COVID-19 have been recorded in the latest 24-hour period. A further 141 people have also died. This brings the total number of people who've died within 28 days of a positive test to 145,281. 26,028 people received their first dose of a vaccine, while 32,356 people received their second dose, and that brings the total number of people to have received their second dose to more than 46.4 million, and 407,851 booster and third jabs were given in the latest 24-hour period, including the Prime Minister, of course, taking the total number of those doses to just over 19 million. The nationwide infection rate now stands at 436 weekly cases per 100,000 people, virtually unchanged, in fact, from the previous week. The place with the highest case rate is Torridge in Devon, with 1,049 cases per 100,000 people. Aside from the Scottish Islands, the place with the lowest rate is Ceredigion in Wales, with 220 cases per 100,000 people. Will do stay with us for this special Omicron question and answer special. Coming up after this short break, our panel will be staying with us to answer more of your questions. Don't go away. Hello again, welcome back to Sky News Tonight. We're answering your questions about the Omicron variant, and I'm joined by the Professor of Paediatrics at the University of Bristol and member of the Joint Committee on Vaccination and Immunisation, Adam Finn, Senior Clinical Lecturer at Exeter University and Public Health Expert, Dr Bharat Pankania, and also the GP, Dr Rosemary Leonard. Great to see you all again. Dr Leonard, why don't we start part two with you? I'm sure you've been asked this question a number of times. Jeanette Griffiths has been in touch to say, what extra precautions do the panel advise the clinically vulnerable take when it comes to the new variant?
The answer is carry on doing what you're doing now. We don't know if this new variant is any more dangerous to the clinically vulnerable than the Delta variant. Certainly, clinically vulnerable people should absolutely make sure they are fully vaccinated. Many of the really vulnerable people should have had 3 vaccines as their primary course. And then we think the advice after that hasn't really been clarified, but they will probably then need a 4th dose, maybe a 5th dose. Best thing to do is to ask their own individual doctors. And also with Christmas coming, just to have a think about how much you want to intermingle with other people. And if you've got a family gathering round, maybe it would be sensible for the other family members to do lateral flow tests before they visit those who are clinically vulnerable, to keep the risk of transmission of the virus to those at risk as low as possible.
Rosemary, is your surgery having a Christmas party this year?
We are indeed. We are. We didn't have one last year. We've all been working closely together, but we are hiring quite a big space. We don't envisage us hugging each other. There certainly won't be any mistletoe. We won't be. I mean, there's been a lot in the news today about mistletoe, and we won't be having any.
No. OK. And of course, we're all being told now that we need to wear masks. Adam, where is the evidence on wearing masks now? Because it's caused quite a bit of a row, hasn't it, in recent days? Some people saying that the evidence simply isn't there, and why should their freedoms be impinged on? What do you say?
Well, I'm fortunate in having a very distinguished colleague who researches aerosols here in Bristol, Jonathan Reed, and he's shared the latest evidence with us recently. It's very, very clear that wearing a mask will reduce the chances of you infecting other people when you have this and indeed other respiratory viruses, of which there are a lot around at the moment. So you can reduce the risks to people around you by wearing a mask. If you wear the kind of mask that we use in hospital, the FFP2s, you can actually protect yourself, because you can seal the mask around your nose and mouth, and you can filter out some of the droplets that are in the air. But wearing a mask, any kind of mask, will reduce the chances of you infecting people around you. And I think there's really no question about that.
OK. Dr Pankania, question for you. This is an interesting one from Thiru. Do we know the vaccine status of the people who have contracted Omicron in the UK? We know more cases have been announced this evening, but do we know whether or not they were vaccinated?
If you had asked me that question tomorrow, I would have said, I know the answer because I've got an incident meeting tomorrow. Having said that, looking at the evidence from other parts of the world, we do know, especially from South Africa, that people who have been fully immunized have got infected with the Omicron variant. That's nothing unusual because you can be fully immunized and get infected. So we don't know. We don't know for the UK people, but the message is, of course, you can get infected even if you have been fully immunized.
Yeah, it's interesting, the debate, Dr. Leonard, isn't it, about mandatory vaccines, something which may well come in Germany and elsewhere. Well, what are your thoughts on that?
Well, we're already seeing it, that those who are working in the NHS and in social care by next April, they must be fully vaccinated. And I know people see this as a sort of a violation of their human rights, if you like, but I think we will be seeing, we're in a time of war, we're in a time of a biological war. And that comes when we have to say what is the best for society. And some of our rights do seem to go away. We have to accept there are sacrifices we have to make. And I think we will be seeing in the UK more and more employers particularly insisting that their workforce is vaccinated to protect the others around them as much as anything else. I mean, I speak to a lot of people who haven't been vaccinated and they say, well, it doesn't matter to me, I'm willing to take that chance. The problem is if they're working with other people who are more vulnerable and they spread the virus to them. So, yes, there are a lot of ethical questions about it, but I can see us moving more in the direction of other European countries and insisting more on vaccination.
OK, I know we've got to say goodbye to you. You've got to dash off. Dr. Rosemary Leonard, GP in West Dulwich in London, thank you very much indeed. Dr. Pankania, I saw you shaking your head there. What are your thoughts on this?
So look, I've been in the business for 30 years, immunizing children, and I know all about the MMR debacle that we had and how worried mothers were with taking the vaccine or not taking it. And I tell you, I have done this for over 30 years. I spoke to my patients, I educated them, I informed them, I told them about the pluses and minuses of the vaccines, and I took them with me. I have a long track record of taking most of my patients with me. I feel very disturbed about forcing people to have vaccines because this is a long-term thing. I don't want to alienate my patients. I don't want to alienate people. I want them to be informed and I want them to make those choices voluntarily. I think it is a failure. It's a failure of politicians, health officers, people like myself in public health, of informing, advising, educating people about the benefits of the vaccine, and we should do that first before we mandate it.
Very interesting. OK, thank you very much for that. One final question. I'll direct this at Professor Adam Finn. We've touched on Christmas parties already, but of course, as we approach Christmas, it is a question many people are asking, isn't it? Including Shrelane, who says, should large gatherings like Christmas parties be cancelled? It's risking vulnerable people in our families.
This is a tricky one to answer. Of course, we're hearing mixed messages from different advisors on this. I can give you my personal view, and that is that I will not be going to any Christmas parties this year. I've got a lot of people who work with me, and I very much like their company, and I like to celebrate the end of the year. But I think with the prospect of another wave as a very real potential problem coming up, we should all be doing absolutely everything we can to minimize transmission, both of the Delta variant that we've got at the moment and potentially this new Omicron variant. So the more you can do to reduce transmission over the next few weeks, the better. And I think Christmas parties is one of those things that we can probably manage without.
OK, very interesting. Dr. Pankania nodding his head as well. We must leave it there, but it's been great getting your thoughts and getting your answers to our viewers' questions. Adam Finn, Professor of Paediatrics at the University of Bristol, Dr. Pankania, Senior Clinical Lecturer at Exeter University, and Dr. Rosemary Leonard, who left a little earlier. Thank you both very much indeed. Really good to get your thoughts this evening.